upon FDA approval, are you going to be vaccinating your frontline workers?
Quickly, we believe. We hear that the process will probably extend through about the 14th of January, and then the vaccine will be shipped shortly after that, based on the approval. So
the 14th of January?
December,
or the 14th of December?
Yeah, forgive me. We believe that we'll be administering vaccine within a day of shipping, so the 15th or 16th of December.
And you have the cold storage necessary. How many, if 16,000 doses, that'll cover, how does that get distributed?
Well, we'll distribute that across all of our delivery sites. We have 12 sites that we'll use for administration of the vaccine. We can administer about 1,800 vaccinations per day. So it'll take us about 9 to 10 days to work through our initial allotment.
So let's talk about that again. You think you can have basically all of your workers vaccinated within about 10 days? And are there a significant number of people you expect to turn down the vaccination possibility? And if so, do they still stay where they are?
We have 28,000 employees in our system. We'll receive 16,575 doses with this initial allocation. Those are prioritized for our frontline caregivers, those who work in a unit that contains COVID-19 patients, or those who regularly encounter people who are infected. And so we won't be able to vaccinate all of our employees, but certainly believe we'll be able to cover most of those who are in those frontline caregiver positions.
So just to be clear, are you giving your workers, are you basically giving the half dose to as many workers as possible, or because it would have to be spaced several weeks apart, or would you give the full dose to half as many people?
Well, we've been assured by the state that we'll receive 16,575 vaccinations, so that encompasses both doses. So we'll proceed with using the full allotment originally, and then plan for 28 days down the road to deliver the second dose.
Interesting. Yeah, it's a kind of a difficult one to figure out, I'm sure, for not least for you. We have to leave it there. Dr. Callender, thanks for joining us to talk a little bit about what your plans are. We appreciate it.
Shepard Smith here. Thanks for watching CNBC on YouTube.